Hi, I'm Dr. Katie, the Senior Centered Physical Therapist, and welcome back to my channel. In today's exercise video, we are going to be focusing on exercises to help decrease pain with hip bursitis. If you want more information on hip bursitis and other ways that you can help treat this pain, check out my blog, theseniorcenteredpt.com, and the article, How to Treat Hip Bursitis. In this exercise video, we are going to be doing an interval training workout. So we're going to do 7 exercises, 1 minute on, 30 seconds off. You'll need a stable surface to lay down on. That can be the floor, that can be a table, that can be your bed. You'll also need a chair or a wall, some stable surface that you can lean on as well. Also, make sure to give this video a thumbs up because that helps people to find my channel. Click on the bell button to get notifications for new videos and subscribe to my channel. Let's get started. So I want to start with a little bit of a warm-up because that's really helpful for bursitis, is warming up our body before starting a new activity. So I'm going to do this in the chair. You're welcome to do it standing. So the first thing, we're just going to do jumping jacks in the chair. If this is too much pressure, just do the arms. If your legs are bothering you, that's okay. We're just getting the body warm. Anything we can do to warm it up doesn't need to be all in the legs. Okay, and 3, and 2, and 1. Let's do some punches. So just shifting my weight. You can kick a leg out if you want. Once again, if that's too much on the legs, don't do it. Warming up that core, which we're going to be doing a lot of exercises with, because that's going to help stabilize our pelvis. Let's go for 5, 4, 3, 2, 1. Let's do some arm circles. We're going to be doing leg circles later, so it'll match our upper and lower body there. Let's go forward. Make sure you're smiling while you're exercising. It helps, reminds your body that this is good for you. This is fun, right? You're loving it. Let's do some marches. Just to the height you're comfortable. If that's this, that's okay. Let's go for 3, 2, 1. Okay, stand up, grab your chair or your wall. We're going to start with our stretches. The first exercise we're going to do is a stretch. It's called an IT band stretch. So you'll need your stable surface to hold on to. This I'm going to pretend is my injured leg. So I'm going to cross my right leg over my left. And I'm going to put a little bit of a bend in my front leg. Then I'm just going to shift my hips towards my stable surface. So if your hand's on a wall, that's fine. Let's hold it for a minute. Right here, you're going to feel a nice deep stretch. Just breathe into it. Good. Keep holding there. What a lot of people tend to do with this stretch is they keep their legs straight and then they tip over to the side. When I do that, I feel my stretch up here. That's why I like to have a little bend in that front leg and then push my hips towards the chair. So I'm not collapsing in the upper body, still keeping the upper body nice and tall, but then my stretch is in the hip versus in the side of my body. Keep taking those deep breaths. Deep stretch. Should feel pretty good to stretch out. Also, depending on how severe your pain is, it could be putting some pressure there too. So if you need to back off, just bring your hips a little bit more underneath you. If you want more of a stretch, you just lean them in closer to that chair. Okay, and then we stand up. I've just placed my chair on the other side because we're just gonna stretch the other side. If it's too much to stretch the other side, or if it's painful to stretch one side or the other, once again, you can just take a little bit additional rest because it's important to rest when you have bursitis. So for this, I'm gonna take my left leg over my right, and then I'm just bending a little, shifting my hips towards the chair. Here we go, let's hold for that minute. Taking those nice deep breaths, making sure we feel the stretch in the hip and not just the side body there. How's your posture? Keep the chest open. We're almost there. A minute's a long time to hold a stretch, but that's what really allows for those muscles in that area around the bursa to have time to relax, to release some of that tension. Once again, if you need to pull out of it a little bit, that's okay. Just wherever you're getting a stretch, but it's not extremely painful. Good, stand it back up. For our next few exercises, we're gonna need that stable surface. So I'm gonna move my mat table to the center of the room so you can see me better. Okay, we're gonna do our figure 4 stretch. So I'm laying down to my side and rolling to my back. And then I'm just gonna cross my left leg over my right. So my ankle is over my right knee here. And I'm just gonna give a little pressure till I feel this stretch in my buttocks area here. So in this example, this is my injured leg here. So here we go, let's hold it. Breathing. If I want more of a stretch, I can slide my foot in. You just don't want that stretch to be too painful. You just want comfy stretch position. You get in the position, you hold it, you allow your muscles to relax, and then we gain some flexibility, decrease the tightness in that region. Keep breathing. If you need to slide that foot back out to give you a little bit of a break, that's okay too. When you're ready, you can come back into it. Almost there. Take your rest. We're just gonna switch sides. So we're just gonna cross the opposite leg over opposite knee if you can. Once again, if it's painful, don't do this one. Just take that extra rest. That's okay. Here we go. We're gonna really focus on the breathing in this one. So feel to where you are stretching. Do you need to push a little more? Do you need to scoot that foot in? We got 3 seconds before we're holding. So find in your comfy stretch position and we hold. Breathing. Making sure the upper body's relaxed. If we're tense while we're stretching, the nervous system won't allow us to relax. And that's really what's preventing us a lot of times from getting more flexible. So if you think about when you're stressed and you tense up, we're not gaining flexibility in that, right? We're tightening our muscles. We're getting those terrible knots in our neck when we're stressed. So we gotta relax the whole body, allow it to stretch, appreciate being in this moment to stretch and feel good. Keep that breathing going, you're almost there. Bring it down and rest. Take your rest. The next exercise is sideline hip abduction. We're gonna start by laying down on our non-injured side. All the way down, I'm gonna keep my bottom leg bent and I'm gonna straighten my top leg. And then I'm just gonna lift it up and down. It's a real small movement and I should be feeling it right there in that buttocks region. Ready? Here we go for a minute. We lift up and down. Imagine lifting from that glute. If you don't feel it, roll your hip forward and lift from there. So my foot's pointing downward. Once again, not a very big movement. And take your time with this. So with bursitis, we oftentimes don't rest enough. That repetitive motion can cause us pain. So if you need to just take a rest, do a little rub, that's okay, then start again. So as our muscles get stronger, we'll be able to do more before we need to rest, but it's not about pushing it, it's about listening to our body to get stronger. Keep breathing. Should feel those glutes really working. Great job. Now we're just gonna switch sides. So I'm gonna push myself up. You can put a towel or a little pillow underneath your hip if it's painful, or if it's too painful, you can do this standing, which I'll show you after we complete this set. So if you're able to, roll down to your side that's injured, little pad underneath. Keep that bottom leg bent, straighten that top leg out, and we lift and lower for a minute. If you can't lay on your side, you're just resting right now. That's okay. Enjoy the break. Once again, taking rest from things that are painful is important for us for healing our bursitis. We don't want to do nothing, but we want to make sure that if we're in pain, we're listening to what our body's telling us. Keep it going. If you need to, take that rest. There's no shame in that. Breathing, getting oxygen to our muscles. We're almost there. Great job. Okay, to do our hip abduction standing, I'm gonna have my chair beside me, or you can have it in front of you, wherever you feel more stable. And we just kicked our left leg in the air. So now I'm gonna stand on my left leg, my affected leg, and I'm gonna put a little bend in my knee so that my muscles aren't totally locked out. So I'm here and I'm a little bit bent, and then I'm just kicking out to the side and back in. Good. One more, back in, and then you would just switch sides. You can do this exercise standing on both sides, and then as you get stronger and you're able to lay down on that hip with the padding, if their pain is decreased, then you can move to sideline. Next, we're gonna do bridges. So I'm just gonna roll onto my back. My feet are about hip distance apart, so not this wide. So they're right under my hip sockets. I'm bracing my belly. I'm gonna use my glutes to just lift my hips up and lower back down. So it's a lift from the glutes, working the back body as well as bracing the core, and back down. Here we go. For a minute. So this isn't putting any pressure on those hips by laying on them. So this one should feel pretty good. Working our hips, working our core, are things we tend to do a lot less than we should. Those are the two things I would recommend people do if they want a healthy back, healthy hips, healthy knees, just to feel better and stronger, is work those areas. Work the hips, work the core. This is a great exercise that's doing both. Once again, if you need that rest, make sure you take it. My knees are going straight forward, so I'm pushing the knees forward, coming back. My knees tracking over that middle toe. Take a rest. We're gonna do our marches next. So I'm laying here. I'm gonna brace my belly. So pretend like someone's gonna punch you. Brace that belly. And then you can put your hands down or on your hips. You're just gonna lift a foot and back down. And then you switch. Lift the other foot, back down. Don't let our pelvis move. Here we go. It's all about stability, working those lower abdominal muscles, helping to stabilize the hips, which is going to help decrease that bursitis pain. We're breathing. Just because we're stabilizing doesn't mean we're clenching. We've just got everything turned on. Nice and controlled with the lift and the lower. You're doing great, we're almost there. Take that rest if you need it. You're almost done here. Rest. Now we're gonna roll onto our belly. So roll to the side. And then I'm gonna get to my hands and knees here. So we're gonna do a plank. So you can either walk your feet back so you're all the way up, or you can walk your knees back so you're at that angle. So my hands are underneath my shoulders here. My knees are a little bit behind my hips, and we hold. Take some deep breaths. We're not gonna hold for the full minute. So can you count to 10 and then put your knees down or walk your knees back in? Take a few breaths, walk them back out. We can count to 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Walk it back in, take a little rest. Okay, I'm gonna try this one on my toes. So I'm gonna bring my feet back, and we go 10, 9, my core is braced, 7, 6, 5, 4, 3, 2, 1. I lower my knees, I walk it back in, I take that rest. You can roll out your wrists, take a rest. Our last exercise is we're gonna do leg circles, so we're gonna come back down to our side. So once again, if you can't lay on this affected side, that's okay. Just watch, and you can repeat it on your non-affected side, your non-injured side. So leg is bent, I lift the top leg up, I'm drawing a circle. Here we go. Let's start. So circle back, the size of a dinner plate. I can feel my core working because it's got to stabilize my upper body. You can be down here as well. Lower your head. We're going to stop. We're going to reverse direction. Takes a lot of control. I like being up here a little bit more, making sure my shoulder doesn't roll forward. So nice and upright, reverse direction. Can you do 4? And then go the other way. So you'll really feel this in the hips. Notice my circles aren't huge. They're controlled. We got about 19 seconds left. Breathing. And we rotate. Woo! This burns the buns. 3, 2, 1, rest. So now if you're able to, you're just gonna switch sides. So I'm gonna bring my legs down, scoot over, bring them to the other side. So like I said, nice tall posture. I like to be up on my elbow. My bottom leg is bent, top leg is straight, in line with my torso. And then I lift a little and I rotate. We got about 7 seconds. Take some deep breaths. This is the last little bit of your workout. Enjoy the burn. Here we go for a minute. Forward and back. One side is probably going to be harder than the other if you're able to do both sides. I'm not as coordinated on my left side. You can also put this hand down as kind of a kickstand. so you don't feel like you're wobbling. But if you want a little extra balance challenge to keep that core turned on, you can pick your hand up wherever you are today. Once again, we're working on listening to our body, not punishing it. Exercise movement is what the body needs. It's not supposed to be something that we hate to do. It's supposed to be something that makes our body feel stronger. To challenge yourself, you can try to make your circle smaller. Can you make it the size of a grapefruit? That takes more control. Rest. I'm gonna sit myself up. You have completed this workout. Congratulations and well done. Make sure you continue to revisit this video so that you're able to increase your strength and help decrease that bursitis pain. As always, I hope you enjoyed this video. Great job on your workout today. Make sure you continue to use this video and use it in your consistent repertoire of exercises to continue to increase your strength. For more information, check out my blog, theseniorcenteredpt.com. Until next time, I'm Dr. Katie, the Senior Centered Physical Therapist. Have the strength to live life to the fullest. Bye-bye.